Hi, welcome to another episode of Medicine Simplified. Today we will know about mandibular nerve anatomy, its codes and relation, branches, and relation to otic ganglion. Coming to mandibular nerve, it is the largest of three divisions of trigeminal nerve, and it carries both afferent and efferent fibers. It is a nerve of first brachial arch and innervates all structures derived from first arch. It innervates lower face including mandible, lower teeth, oral mucosa, anterior two-thirds of tongue, lower lip, TMJ and masticatory muscles. Coming to the codes and relations, begins in middle cranial fossa. Consists of large sensory and small motor root. Sensory root arises from trigeminal ganglion and leaves through foramen ovale. And motor root lies deep to the trigeminal ganglion and passes through same foramen ovale to join sensory root to form main trunk in temporal fossa. The main trunk divides into small anterior and large posterior trunk. Coming to the branches, here is a diagram of mandibular nerve. Coming to the main trunk, passes through foramen ovale, mesenteric branch, deep temporal nerve, buccal nerve, nerve of lateral pterygoid, nerve 2, medial pterygoid, meningeal branch, which is also called as nervus spinosum, auriculotemporal nerve, and cauda tympani nerve from facial nerve, which joins with lingual nerve of mandibular nerve. Now to mylohyoid, which also supplies digastric muscle, mandibular foramen, and which supplies to dental, and here is a mental foramen and is a mental nerve. From main trunk, a meningeal branch, also known as nervus spinosum. It enters skull through foramen spinosum. Supply the dura mater of middle cranial fossa. Second one is nerve to medial pterygoid. Arises close to otic ganglion. Supplies the medial pterygoid from deep surfaces. Gives a motor route to otic ganglion and supplies tensor veli palatini and tensor tympani muscles. These are branches of main trunk. Coming to the anterior trunk, first one is sensory branch, which is buccal nerve. It is only sensory branch of anterior trunk. Passes between the two heads of lateral pterygoid. Supplies to skin of cheek, mucous membrane of buccinator and labial aspect of gums of molar and premolar tooths. The motor branches are mesenteric nerve, which emerges in front of TMJ, enters the deep surface of masseter. Also supplies TMJ. Deep temporal nerve passes between skull and lateral pterygoid and enter deep surface of temporalis. There are two nerves, anterior and posterior. Now to lateral pterygoid. Enter to deep surface of lateral pterygoid muscles. Third one is from posterior trunk. Auriculotemporal nerve arises by two roots which encircles middle meningeal artery and unite to form single trunk. Auricular part supplies the skin of tragus, upper part of pinna, external acoustic meatus and tympanic membrane. Temporal part supplies skin of temple. Auriculotemporal nerve also supplies parotid gland and TMJ. Coming to the lingual nerve, it is a sensory to anterior two-thirds of tongue and floor of mouth. Lingual nerve begins 1 cm below the skull, joined by cauda tympani and lies in contact with mandible near third molar. Coming to inferior alveolar nerve, it is the largest terminal branch of posterior trunk. It enters mandibular foramen and runs in mandibular canal, accompanied by inferior alveolar artery. Coming to branches of inferior alveolar nerve, first one is mylohyoid branch, contains all motor fibers of posterior divisions. Second one, branches that supply lower teeth. Third one, mental nerve, which emerges at mental foramen and supplies the skin of chin, mucous membrane of lower lip. Fourth one is incisive branch, supplies the labial aspect of gums of canine and incisor teeth. Coming to the relation of Otic ganglion with mandibular nerve. It is a peripheral parasympathetic ganglion. Relay secretomotor fibers to parotid gland. Topographically related to mandibular nerve but functionally related to glossopharyngeal nerve. If you like this video, please do subscribe to our channel. Thank you.